Very happy to come to Nagaland. Thanks to thanks for accepting our invitation and being part of this press conference. We are here to actually explain you or tell you that we are very happy that we have got tied up with Nagaland government for treatment of Nagamis patient. And whatever the government scheme is there, CM health scheme which is there, which is running, that same scheme will get applicable in our hospital. And that too, it is on credit basis. So you know that scheme is basically for common public. It is about 5 lakh rupees treatment is available. For government employees, somewhere about 20 lakh rupees is available. But again, when we had discussion with government, they have told if treatment cost is exceeding by 5 lakhs, usually they will go and take a approval from the government and it will get converted to 10 lakhs. So that is how they have told us. So that feature is available. So basically they have to just approach and they will revise it and give. So this is what has been communicated to us. So before going in depth, to give you an understanding, I just want to show you one video about our hospital, because I know many of you would not have seen our hospital. So we want you to show our hospital how it looks. Can you play the video?
The mother understood that with education, birth and benefits provide the best education for the children. As the time marched on, they announced others in the world means something to them and is inspired by their path and success. But who are these three brothers? Mr. Rao, Dr. Surendra, Mr. Surendra, and their mother, Mrs. Yashoda, the name that was reached when one talks about trusting and the best preferable thing. Back in 1989, Yashoda Hospital was a modest facility in Hyderabad, 50 beds, with the home providing care for domestic and international patients. As such, not just inside, but also number, by adding fewer hospitals to the more than 12,000 Press hard investment. These state-of-the-art hospitals are beautiful for thousands of patients with its all-round holistic medical neuropathy. But this journey hasn't been easy, with infrastructural challenges to administrational difficulties and a constant endeavor between the finest of doctors across the country under one umbrella. The perseverance and hard work born into these hospitals is the reason it is today considered the top hospital chain that puts people states and is recognized as one of the best hospitals in the country. The three brothers, but they designed and gave back to the society and it gave them so much, founded the Yashoda Foundation in 2011. Their goal was to continue the humanity on the earth and make a positive impact in the minds of young children. The Yashoda Foundation provides programs such as Abhaya, Akshara, Bharati, and Madhu. Abhaya is a social inclusion through employment training. Akshara, tuition support, Bharati, advocacy program with orphans to raise awareness and support for their needs, and Madhu, the community development of young people. Around 4,000 children are currently benefited by this project each year, and more than 100 batches of students have graduated as of this year. This journey of three brothers and a lovely mother is just getting started.
So like you saw, we have 4 hospitals. Currently we have somewhere about 4,000 beds in 4 hospitals. We started somewhere in 1989 with a 50-bed hospitals. This hospital is run by 3 directors or 3 owners who are all brothers. One is engineer, one is a doctor, and one is a CA. So it started in 89. Today we have 4 hospitals with around 4,000 beds. 5th hospital again in Hyderabad is coming up, and 2 more are coming up in Bangalore. So that is how our growth story is there. We have nearly all the major specialties, all high-end equipment. Apart from patients across India, we also get patients from somewhere about 50 countries across the world. And for Nagamese patient and for even for other Northeast, we have separate health desks. Like for Nagamese patient, we will have a health desk which is run by Nagamese people. The model which they serve is that if anybody is traveling from here, we have our own team here. We have Lohit here. We have Lohit here. So he will have 3-4 people team here. So anybody who wants to travel, if they approach, we will make sure there when they land in Hyderabad, we give them complimentary pickup to hospital. They get priority in terms of seeing the patient because they are traveling from far. So they will get easy appointments. In case they require guest house, that also we will arrange and give. And till the treatment is completed, in case they have any difficulty, we have lot of nurses and technicians and few doctors from this part of the area. So they are all there to help you out in terms of communication and counseling. And once treatment is over, again leaving them, dropping them back to airport. Till that, we are somebody who will take care. So that is how this whole desk will operate. So, apart from that, we are also planning to start OPD of super specialists. Today with me, there are 3 doctors. So we have Dr. Vikram Reddy, who is our cardiac thoracic surgeon. We have Dr. Naveen, who is from gastro department. He has a very big team there. We have Dr. From radiation department, so Pradeep. So all 3 are here. So every month what we are thinking is we will bring our doctors here from various specialties. We will be doing OPD here at Dimapur and also at Kohima to start with. And probably we may extend to other places also with time. And we will be doing OPD outside also and along with government in the government facility also, in district hospital also. So that's the discussion which is currently going on. So this whole press meet is to give you an update about what is happening. So what I will now do is I will ask our doctors to speak to you for a few minutes. Then if you have any question, we will be happy to take it. We'll start with Dr. Naveen. Dr. Naveen.
So good afternoon and thank you everyone for having us here. Welcome from Yashoda Hospitals. I'm Dr. Naveen. I'm the clinical director for the gastroenterology and liver diseases in Hyderabad. I work in Yashoda Hospitals, Hyderabad. So as Mr. Karthi has already mentioned about the hospital infrastructure itself, it's massive hospital with a lot of excellent equipment and latest state-of-the-art equipment that we have. And we as doctors, we feel happy that we have this equipment because at the end of the day, we want to give the right treatment for our patients. And for that, we need the right skills, right equipment, and the right infrastructure, and the compassionate towards a patient. And we believe in that we give the compassionate treatment to our patients. We want our patients to get better, walk out of the hospital happily and healthily. So that's what we always believe in it, and that's what we care for. So coming to the gastro department, as Mr. Karthi has said, we have a team of doctors who specialize in different areas of gastroenterology and liver disease as well. We have actually, our center is a renowned center for the Asia Pacific training center. We have a lot of doctors who come from different parts of the world to get trained under us. In fact, right now we have doctors from Nigeria and another doctor from Congo in Africa who are with us right now getting trained. We had doctors from Algeria, Tanzania, Mozambique, Vietnam, along with the doctors nationally also who come regularly for getting trained in different various fields of gastroenterology. So we do run this kind of a training program, As I'm sure you can understand, if you're running a training program, but that means you provide center of excellence to our patients. We won't be running a training program if you don't have an excellent training, excellent services with us. So we are happy to have any of the doctors who are here who wants to get trained in whatever areas of the gastroenterology. We are happy to handhold them. It's always about learning from each other, making them better doctors, learning, getting experiences, and hand-holding so that we can serve the Nagamese population. We always feel pride and happy in helping out whoever the doctors are, wherever they are, so that they can in turn serve the community and the people around them. So we're happy to have you all. Any doctors who wants to get trained under us, we're happy to have them as well. Please contact us. We will be happy to arrange them. And again, in terms of teaching, in terms of patient load, as I said, we cover length and breadth of all the gastro from simple to complex cases. We also do liver transplants at our center. We have a high volume liver transplant at a very affordable prices. Okay, so what we strive in ourselves is give the quality of care, center of excellence in gastro and liver diseases. So we look at that and then give the best for our patients. Okay, so any questions you have, we'll definitely take it at the end. Thank you. Over to Dr.
Motivated the hospital to tie up with the Save a Child scheme?
With the Nagamese scheme. See, we always believe in providing the right services to our patients. We've been doing similar kind of clinics in different parts of Northeast. For example, we go to Siliguri and also to Gauhati and other places as well. And what we realized is there is a dearth or a lacuna in terms of the service care compared to what we see in other parts of of India. So that's why we thought this would be a better opportunity for the people over here to get treated better. The whole idea is, of course, we want our patients to get better, and we see a lot of patients coming from Northeast who come to us. So rather than them coming all the way to Hyderabad, so if we can come here and then serve the people here, and whoever needs to be, that can't be taken care in Nagaland, they can come and get treated in Hyderabad. So that's the idea of having this collaboration.
What is the transparency of billing and having the bills and all?
That sir can answer about that question.
See, currently what tie-up we have got is a CGHS rate tie-up. Whatever government rates are there, on that the tie-up has happened. So your billing will happen on that rate, which will also come to government as one copy for their reference. So that will explain you the transparency part. This whole thing started basically because we started getting some patient from Nagaland, and then when they were getting treated, they were asking, do you have a tie-up? If you have, then we would like to use that tie-up. So that gave us a sparky, okay, there are people who are coming here and they are paying completely by cash. In case we do this, if it can be help to the patient, we will be very happy to do that also.
Can you elaborate on the eligibility of the patients holding the card? There are two types of cards.
Okay.
One is for government employees and other is for general cards.
Okay.
So we accept the general patients.
General patient, that's what I was telling. For government, I think they have some 20 lakh limit, and for general patient, there is about 5 lakh limit. Both the cards will be accepted.
So the website only shows employees and pensioners. There is no mention of general cards.
Its general card is the main card there, so it is there.
Just check.
Website. Okay. Any which ways, I am giving you a press release at the end of this. In that, it is mentioned. So you have a document also for that.
Okay, as you have mentioned earlier that some of the Naga doctors also visit there. Can you be accurate on how many doctors are there?
Mostly we have nurses. So if you look at numbers, then mostly we have nurses, and we have people working in admin area. Doctors are relatively very less from Nagamese side, but Northeast we have got, overall Northeast we have got doctors.
And so as well as the health tax, right? You mentioned about the health tax also, where people can for easy complications. So there are people working there?
There are people working there. Even in the video you could see some nurses who are from this part.
Regarding the OPT that you have been mentioning earlier, so that OPT will be tying up, you guys will be tying up with the district hospitals?
We will be tying up with both district hospital, and we will be also doing with private. Both will be there. District hospital mainly because the end of the day somebody is traveling from here, he is not going to travel for cough, fever, cold, all that he is not going to travel. So when my doctors are coming, if they are able to see complex patient, they will also be happy and patient will also be happy to travel. So district hospital will that way provide that edge, wherein the normal doctors will first see, they will list out the patient whom has to be shown to our consultant who are coming, and then that will be a clearly vetted patient who require particular service which is not available or something which is required which is of a higher technology which they require. So it becomes easy for us to screen patient and then ask them to come there, or if we can treat it here, we can treat it. Our doctors will also support the government doctors in case the same treatment can be provided with the help of them. So we will do that also.
Not only that, we will also be helping out in training the doctors as well, so that we all learn from each other, right? So there are certain things that we see that we would love to share to the doctors over here, the younger doctors who wants to aspire to become better doctors. So we are happy to share our knowledge. That's how we all learn from each other.
One thing what we could understand is when we met all the officials here, they are very keen to develop the medical system here. They are very keen to ensure the people here get jobs. They are very keen to ensure some training if you can give, we will be very happy. So we have offered them that if you want to start any new particular specialty, new particular service, you want doctors training, whether you want nursing training, technician training, all that we will be offering. You send the people, we will give the training free of cost. We will not charge anything from you. We will train them. If you are starting a new service, to start, if you require initially any support, you want our doctors to come here, like you want to start some transplant, you want the first to transplant where you want our doctors to come here and help, we will be more than happy to do that.
We had a few doctors from Durgapur and oil area. Dibrugarh. So we had few doctors from there who just came to get trained with us in endoscopy and other procedures. So we were able to handhold them, train them. They went back and they started doing it in their own centers.
When are you going to start OPDs in the
Probably a month time. So discussions are going on. I think from next month onwards we should be able to start.
Can you be particular about the date when you have tied up with Nagaland?
I think we did it some 20 days back. And we started, trying to reach out to everybody through digital media. Response was also good. I think somewhere about 200 people have approached us that have asked us how to come, what is the treatment. So we are in discussion. Even the first patient is planning to travel in next 2 days from here.
Supplementing by our friends, how many days in a month you are planning to visit here, your hospital are planning to visit here in Nagaland to treat the patients? Can you specifically tell us the schedule, time, dates and all?
Dates and schedule we will give it to you once we fix the place and location, all that. But usually how it will be is, there will be different set of doctors coming on different days. So monthly once, one particular specialty, one doctor will be coming to start with. If there is a good patient load and we have to come again, then we will increase that spacing. Yeah.
So, good afternoon. Thank you for hosting us. I am Dr. Vikram. I am a senior cardiac surgeon at Yashoda Hospitals. Though I am coming from cardiac surgery, I am also representing cardiology, vascular and thoracic surgery as well. So, at Yashoda we have a very good established cardiac surgery and lung surgery program. So, we do all from simple bypass surgery, valve surgery to complex aortic surgery, second time, third time redo surgeries as well. And within the thoracic surgery, we do all types of lung surgeries, and with advanced investigative bronchoscopes and bronchoscopic therapies. And we also have established heart and lung transplantation program. And we are actually the lead the lung transplant. We have a lung transplant program at Yashoda hospitals, and within the cardiology, we have advanced cath labs with where the cardiologists who are very experienced, like more than 30-40 year experience, and they do all types of complex angioplasties. The percutaneous valve like this, they represented here. The percutaneous valve, which are the latest, where the patient who are not suitable for open surgery, they undergo these percutaneous valves. And we have established heart failure clinics as well in Yashoda, where these patients who are not deemed for any surgical procedure, they are managed in the heart failure clinic, and subsequently they are screened for transplantation program. And we also have proper vascular surgery departments, where the patients who have peripheral vascular disease, who need surgery or medical therapies, so they are all sorted out. And with this department, they are all the supportive department, like very good pulmonology department, very good nephrology department. And unfortunately, they were supposed to be here talking, but they had a family urgency, so they couldn't come here. So we have a very good nephrology department as well. They do every day like 200 dialysis machines running. So every department, like even gastro, every department, oncology, they're all supported, interlinked, and the patient gets a proper holistic treatment that we can guarantee. And as you, madam, you were asking about what guarantee, like what's the difference? Definitely, the people, everyone, I think they are used to go to Delhi. I worked in Delhi for a few years. So I'm sure once we start getting patients from Nagaland, and you will definitely get the feedback from the patients, and you will note the difference, what the care we offer, and what empathy we give the patients. So I'm sure they will be happy and give you a good feedback. Thank you.
Last question from my side. How does the hospital plan to handle the inflow of patients under the scheme?
Currently, though, we have to start. Inflow is something which we can.
1 month back, now you are talking about it.
No, I'm telling you, handling inflow is very, very easy for us, because as such also we do somewhere about around 12,000 OPDs in a day in all our hospitals put together, and we have a very good and very big set of consultants. So managing patient is not a difficulty for us. So probably if you visit once, you can understand how we work. And our systems are also done in such a way that we exactly know. Like I said, we have a separate team for Nagaland now. Like that, we have separate team for Sikkim. We have separate team for Bengali patients. So they are a separate desk. And when they come to the desk makes sure that they get priority in everything, because they have traveled from far. So we have a well-oiled system which runs in that fashion. So we also understand, traveling from a far-off place, they all would like to go back also fast. So we always put them in a different kind of looping, wherein they get priorities and they are able to get treated and go. Usually within a day or probably 2 days, they will get their complete diagnostic. They will know what is the issue, what has to be done, and then immediately they will get slots for OT. They will not have any kind of waiting anywhere. So that's a system which is currently running. So this is an addition to that.
It's a pretty streamlined system. You will not get lost. And there, none of the patients get lost. They feel happy because they've been taken care, hand-holding them from the start, when they enter to the hospital, going to the outpatient department, going to the investigations, going to the admissions if the patient needs admission, and any sorts of processes. There are people who can help out. We believe in ecosystem, and that ecosystem has been built very nicely. You won't get lost.
Somebody coming from Nagaland, they will know who is their coordinator. The person will be available 24/7. So, like that, they will have a phone number which is accessible for them. The minute they call, there will be people who are there to help.
See, for us as doctors also, so we know that we want to get certain tests for this patient. We don't have to worry about it, because there's always somebody there to take care. We just write down what investigations we need to do, and there are people who can take care and then get those tests done quickly and then get back to us.
One thing, just want to know, besides getting medical facilities that you are explaining now, since you are coming to Nagaland and trying to associate with people of the state, is there any plan or chance of getting employment for Nagaland?
Some
Maybe
discussions.
Hyderabad or maybe here.
No, some discussions are running. Already we will take at least 2 or 3 people in our team itself who will be stationed here to coordinate all this. But apart from that, we are working along with government. Some initial discussions have happened. There are 2-3 things which we are discussing on. One is while our doctors are coming here, they will also be teaching the students. I think first batch of medical students are going to come out. They are in 3rd year or 4th. They will be moving to 4th year. So our doctors will also become part of their curriculum where they will teach. Apart from that, there is a skill development program which is running here. So we are going to have a meeting with them. Initial discussion has again happened. So we are looking at coming here, doing a sort of a interview and taking people for various other departments, which will include nursing, technician, front office, and various other departments also. We are planning to run a program here. Probably I think 1.5 month duration, we should have one kind of walk-in sort of a thing. Along with government, again along privately also we will do. We do it more with government because they give us access into various colleges, they will talk and that has its own impact. We do private also because a lot of people don't go through that channel. They will rather try to come directly. So both options we will have.
Last question from my end. It is just a friendly question to the management and treatment outside of the state for the people of Nagaland and for the people of the Northeast is an expensive affair out here. So is it the hospital provide any special privilege or concession to the people of the Northeast?
To be very frank, this CGHS is not available in southern part of the country, which means even including Telangana. We don't take CGHS patients. Only for Northeast we have said okay. So CGHS is roughly around 50% of our tariff. So whatever they are going to get billed is already in a discounted way. So we'll ask Dr. Pradeep to have few words.
Good afternoon everyone, and I am Dr. Pradeep, consultant radiation oncologist from Yashoda Hospitals, Hyderabad. And thank you everyone, and thank you Nagaland for embracing us and allowing us to serve you better. And first of all, I would like to touch upon oncology. As you know, cancer cases are much more rising in Northeast, especially in Nagaland. As I am seeing the stats every month or quarterly, we see that more pronouncing is on the Northeast side. So, and also because of the habits of tobacco chewing and much more, we see a lot of head and neck cancers here, as well as even GI cases. So the most important thing for cancer patients is the time to treatment. So if a patient gets treatment in time, he gets cured. But as the prevalence keeps on increasing, and because of the lack of resources or limited resources, patients may get waiting times. And because of this, they also upstage, like early stages become advanced stages. So in this scenario, it will be from our part, we thought it would be better we can serve you and also allow you to get the treatment in time. If you flew down to Hyderabad and if the resources are less here or not limited, and if they are not able to serve all the cancer patients. And also the other thing is infrastructure. The availability of the advanced infrastructure helps in curing even the complex and challenging cancer cases, as we treat day by day with robotic surgeries and advanced radiation machines, including the MR-Linac, which is only one machine available in Yashoda hospitals all over India. And we are the pioneers in treating complex cases within very short span of time. As you know, treatment of cancer takes months. And with the advancement of these techniques, we can finish them within few weeks. Some cases we are also able to do radio surgeries within 5 days. So This directly benefits the patient in reducing their financial burden to stay somewhere else, as well as getting treated in very quick time. And also, along with this, we'd like to collaborate with the people here and the doctors so that we can share our knowledge, and whatever the knowledge and infrastructure we have, we are also able to share with them, and they can increase the awareness so the primary physicians can identify the cancer cases in early stages that increase the highest cure rate. So we'll be happy to serve the people of Nagaland whoever wants to get down to there for cancer treatment, or who want to get consultations here itself. If you have any questions regarding oncology, please feel free to ask. Thank you.